In this film, we'll examine the effective use of the OB3000 medical suction unit and demonstrate the procedure using a CPR mannequin to ensure you're prepared for real-life situations. Before we begin, make sure the OB3000 is fully charged or connected to a power source and all the necessary components, such as the suction tubing and canister, are assembled and ready for use. Turn on the unit and set the suction level to an appropriate setting. For most situations, a medium suction level is sufficient to start with. You can adjust it as needed during the procedure. Position the patient, or in this case the CPR mannequin, so you have clear access to the mouth and airway. Activate the suction unit by covering the control port on the catheter with your thumb. Ensure the patient's head is tilted back slightly to open the airway. Using the suction catheter, insert it gently into the patient's mouth. Be cautious not to cause any injury. Move the catheter in a circular motion to ensure you clear all secretions from the mouth and throat. Suction for no more than 10 to 15 seconds at a time to prevent hypoxia. Allow the patient to rest between suctions attempts if needed. Monitor the effectiveness of your suctioning. If secretions are thick or difficult to remove, increase the suction level slightly and continue. Always be mindful of the patient's condition and adjust your technique accordingly. Periodically clear the catheter by releasing the control port and flushing the catheter with sterile water or saline, if it's available. This prevents blockages and maintains effective suction. Once the airway is clear, turn off the suction unit and carefully remove the catheter from the patient's mouth. Dispose of the catheter and any disposable components according to your facility's protocols. Perform a quick check of the patient's airway to ensure it's clear and they're breathing adequately. Reassess the patient regularly and be prepared to repeat the suction process if necessary.